Hello, my name is Ya-Ching Hsieh, and I am a research associate with the Icahn School of Medicine at Mount Sinai. Today, we'll be presenting our findings on the topic of mood and suicidality among cyberbullied adolescents, a cross-sectional study from Youth Risk Behavior Survey. Our team and I have no financial or funding to disclose, nor do we have any conflicts of interest in the industry. Here are some background information. Bullying has been shown to have many adverse effects on the mental health of adolescents. These adolescents who are bullied often suffer symptoms such as low mood, anxiety, and depression, which disturb their daily lives. In today's younger generation, there are many changes in social activities and interactions moving from in-person to the electronic and virtual space. Likewise, bullying can now also occur in these online social media and interactions. In 2017, the National Institute of Mental Health reported that approximately 13.3% of American youths ages 13 to 17 are depressed, while the Royal Society for Public Health and Young Health movement reported that in the past 25 years, there has been an increase in depression and anxiety by 70%. In the Adverse Childhood Experiences studies, it was found that there is a 4-fold increased odds of depressive symptoms and 12-fold increased odds of suicide attempts in children who reported more than 4 adverse childhood experiences. However, in the ACE, cyberbullying is not included in the experience of violence. Middle and high school students face bullying on school ground. However, with rise of social networking platforms, cyberbullying, it is estimated that 1/3 of these students are being cyberbullied. With our study, we want to determine the prevalence of cyberbullying of the youth respondents in the Youth Risk Behavior Survey and how it affects adolescents' depressive symptoms and suicidal behavior. How did we carry out the study? Our study population consists of data from the years 1991 to 2017 National Combined Youth Risk Behavior Survey. We looked at their demographic characteristics including age, race or ethnicity, grade level, and gender. To determine low mood and suicidality, we selected questions that captured the variables. These questions were, during the past 12 months, did you ever feel so sad or hopeless almost every day for 2 weeks or more in a row that you stopped doing some usual activities? During the past 12 months, did you ever seriously consider attempting suicide? During the past 12 months, did you make a plan about how you would attempt suicide? During the past 12 months, how many times did you actually attempt suicide? If you attempted suicide during the past 12 months, did any attempt result in an injury, poisoning, or overdose that had to be treated by a doctor or nurse? To assess cyberbullying behavior, the question selected was, during the past 12 months, have you ever been electronically bullied? Data was analyzed using chi-square tests, multiple logistic regression for adjustment and association of the factors. After statistical analysis, we found that 1/4 of 15 to 17-year-old respondents had experienced cyberbullying, with 68% being females and 32% males. Caucasian ethnicity experienced the highest number of being cyberbullied at 53%, and next with Hispanics at 24%. After comparing cyberbullied versus not cyberbullied youths, we found that cyberbullied youths had higher numbers with feelings of sadness and hopelessness. Comparing youths who were cyberbullied to not cyberbullied, more cyberbullied youths experienced sadness and hopelessness. These youths were also at significantly higher numbers for considering suicide, making a suicide plan, and attempting suicide. After controlling for age, sex, grade, race, tobacco, alcohol, and substance use, we found that the odds of cyberbullied youth having sadness and hopelessness was 2.5 times greater, considered suicide was 1.5 times greater, made suicide plan was 1.2 times greater. There are some study limitations with survey studies, even though it is collected from a large population. The limitations primarily consist of biases including recall bias, respondents bias, accuracy of the history, and varying perspectives. In conclusion, much of the population in the developed countries are typically online, with the internet increasing our dependency on online services. The active and steady encroachment into our private space seems inevitable. Cyberbullying has been associated with negative mental health outcomes, the most commonly associated conditions being sadness, hopelessness, suicidality, anxiety, substance use/misuse, self-harm, and anxiety. We found similar results in our study. Further studies are warranted on the long-term outcomes of youth who experience cyberbullying. Thank you.